Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, CMS adds enhanced barrier precautions to infection control guidance. New guidance issued to providers and state agencies adds the use of PPE during high-contact care activities to its infection prevention and control standards effective April 1, 2024. Enhanced barrier precautions require the use of gloves and donning and doffing of gowns in 6 high-contact activities, but is less stringent than existing contact precautions. CMS said that more than 50% of nursing home residents may be colonized with an MDRO. New recommendations include the use of EBP during high-contact care, chronic wound care, and indwelling medical device care, regardless of the MDRO status, in addition to the resident having infection or colonization with a CDC-targeted MDRO when contact precautions do not apply. Facilities should use discretion when implementing EBP and balancing the needs to maintain a home-like environment for residents. Residents should not be restricted to rooms or limited from participation in group activities. Precautions are intended to be in place for the duration of a resident's stay and resolution of the wound or DC of the indwelling medical device. EBPs are important when dressing, bathing, transferring, providing hygiene, changing linens, briefs, and assisting with toileting. They're also required for a resident using a central line, urinary catheter, feeding tube, trach vent, or any skin opening requiring a dressing. Precautions would not necessarily be needed when performing transfers in common areas, such as dining or activity rooms, because contact is anticipated to be shorter in duration. Facilities also have discretion in using EBP for resident-only infected or colonized with MDROs not currently targeted by the CDC. Maintaining contact precautions when handling nursing home residents colonized with MDROs not only benefits nursing homes, but also other nursing homes and hospitals. EBP is intended to reduce the risk of MDRO transmission by HCPs who may carry or spread MDROs on hands or clothing, known as silent spreaders, while caring for high-risk residents. Education and differentiating EBPs from TBPs will be key to successful implementation. Next, policy changes along with higher wages are necessary to support direct care workforce, experts say. Though wage increases are an important first step, larger systemic changes will be necessary to solve workforce challenges. Employer and agency support systems must be responsive to staff and resident needs, but require additional resources to develop in general. Higher wages and benefits is paramount, but additional training along with increased supervisory, peer, mental health supports are central to sustaining workers. Direct care workers earned an average of $15 an hour in 2022, with a median annual salary just below $24,000, according to a PHI national study. Many work second jobs relying on other benefits such as subsidized health and child care, food benefits, and housing assistance to make ends meet. Wage increases can help address issues and improve direct care worker recruitment and retention. Bonuses for long-lasting, well-performing staff make positive impacts on retention. Career advancement opportunities and better workplace benefits also make direct care work more attractive to new hires and keep existing staff eager to work. For this to happen, Medicaid HCBS programs require better federal and state funding, and federal funding can facilitate participation, leadership skill development, and networking opportunities at a national and state level. The federal government can act to take bipartisan action to strengthen the direct care workforce and initiatives to provide support that's already in the works. In October, Senator Bob Casey introduced the HCBS Worker Relief Act. The legislation increases the federal medical assistance percentage for state Medicaid programs by 10%. This payment bump could potentially free up hundreds of millions of dollars for HCBS programs nationwide, allowing them to implement critical workforce solutions. Bipartisan efforts would accelerate dementia care workforce preparedness and access to care. A bipartisan bill would better prepare PCPs to diagnose and care for residents diagnosed with dementia, according to the Alzheimer's Association. H.R. 7688, Accelerating Access to Dementia and Alzheimer's Provider Training Act, would reauthorize the Alzheimer's and Dementia Care Extension of Community Healthcare Outcomes Program to provide free video conferencing for Alzheimer's and dementia education and training to PCPs. This will increase access to early diagnosis and quality dementia care in communities across the nation, reducing geographic barriers and cost of care. According to the Alzheimer's Association, only half living with Alzheimer's diagnosis are diagnosed, and of those, only half are told of the diagnosis. PCPs make the initial diagnosis in 85% of the cases, and they report feeling unprepared to provide care because they cannot access appropriate dementia training. The bill, introduced March 15th, would build on the current program to provide grants specifically for the Alzheimer's and dementia diagnosis to address knowledge gaps and workforce capacity issues. The Dementia Care Training Program from the Alzheimer's Association is one of the first in the country focused on improving access to dementia care. A fiscal year 2024 appropriations package signed Saturday by President Biden will increase funding by $100 million for research into Alzheimer's and other dementias at the National Institutes of Health, allocating $34 million to fund and continue to implement bold infrastructure for the Alzheimer's Act. The Alzheimer's Association and AIM also sent a letter last week to the Senate Health, Education, Labor, and Pensions leaders in support of reauthorization of the Older Americans Act. The organization said that an estimated 6.9 million Americans 65 and older are living with Alzheimer's and dementia today, with cost of care projected to reach $360 billion this year. In addition, total payments for all healthcare sectors for residents living with dementia is projected to increase by nearly $1 trillion by 2050. The groups asked the committee to consider policies to reduce barriers and ensure access to LTC and home and community-based services. People living with these diagnoses make up a significant portion of all LTC residents, so a strong dementia care workforce is needed to ensure quality of care for the aging populations. And last but not least, senior care bots become a global phenomenon. Developers aim for collaborative intent with caregivers. The robots will not be taking over. A robot revolution will not be taking place in senior living facilities, nor is that their intention. Despite recent concerns about how robots coexist with caregivers, companies are releasing new models and new data that shows how they add value to the communities. Intuition Robotics recently released new data affirming their robotic model actually inspires better socialization among residents, part of its goal to reduce loneliness in senior living communities. Intuition partnered with academics to create Cobot i7 scale to serve as an objective model for the evaluation of robots' social utility. An Australian tech company showcased their army of helpers designed for LTC at a tech conference in Sydney last week. The fleet includes meal delivery, cleaning bots with colorful model names like Bella and Flash for specialized maintenance tasks, insisting rather than competing with caregivers, robots allow staff to focus on more meaningful tasks like attending to residents. One criticism levied against the bots in a recent article published in The Atlantic argued rather than helping existing LTC staff, robotic assistants instead created new burdens like cleaning or troubleshooting. Developers are aware of the usability concerns, but the bots are not a nightmarish IKEA assembly project. While some robots have flaws that create burdens for caregivers, these bots were designed with caregiver and the residents in mind. Caregivers don't have to assist people in learning how to use the bots, since AI teaches the residents and setup is pretty simple. Previous studies showed the bots made residents feel less lonely, and the latest research revealed 56% of bot users reported improved connection with peers. Thanks for joining me on News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.